Welcome to Applying for Disability Insurance, Joanna Morales. My name is Christine Benjamin. I'm the chair of the Information Task Force, and we have Dana Mooney providing technical and emotional support. And in a moment, I'll introduce our speaker. All participants will be muted during the presentation. You're invited to submit questions through the question pane anytime during the presentation. Questions will be read to the presenter at the end of her program. Please keep questions general in nature so that all may benefit from questions being asked. If you have questions that are more personal in nature, you're encouraged to email Triage Cancer at info@triagecancer.org. Now I'll introduce our presenter, Joanna Morales. Joanna is a cancer rights attorney, author, speaker, and CEO of Triage Cancer, a national nonprofit organization connecting people to cancer survivorship information through educational events, speakers bureau, and online materials and resources. She also serves as principal of North Star Alliances, a business consulting and service firm. Joanna has served the cancer community for more than 23 years, including at Triage Cancer as an adjunct professor at Loyola Law School, teaching a course in cancer rights law, and at the John Wayne Cancer Institute's psychosocial care program. Joanna has presented hundreds of seminars on employment, insurance, healthcare, and advocacy issues throughout the country. She's been published in a variety of publications and serves on numerous health community committees and boards, including the American Cancer Society, California Division Board of Directors. She was also recognized by the Los Angeles Daily Journal in 2010 as one of the top 20 attorneys in California under the age of 40. Please help me welcome Joanna Morales. Thanks, Joanna.
Thanks, Christine. Good morning, everyone, or good afternoon, depending on where you might be in the country today. Today, I was asked to provide you with an overview of applying for disability insurance. And that actually involves a couple of different topics. And so I want to share with you a little bit about your ability to take time off from work through your employer's leave policies, what states provide you options with, the Federal Family and Medical Leave Act, and then talk a little bit about how the ADA might be helpful to you and reasonable accommodations. And then I'll spend the majority of the time talking about disability insurance. But before I do that, I want to make sure that you know that this is really just an introduction to many of these topics, and I want to point you towards other places to go for additional information. So just to share with you a little bit about our organization, we are a national nonprofit that provides information and education on all types of cancer survivorship issues, including many practical issues like finances, employment, disability, and health insurance benefits. And we do that through hosting of educational events around the country. So if you want to find out if we'll be near you soon, you can take a look at our website. But we also host a free cancer survivorship webinar series where you can watch the webinars live, or you can also watch the recorded webinars at your convenience. And then we also have a resource website with international, national, state, and local resources on all types of cancer survivorship issues, but on many of the topics that I'm going to refer to today. So you can find more information about where you live on that site. And because sometimes what is available to you is based on where you live, we also keep a record of what's going on at the state level. And so we have a chart of state laws that talk about some of the benefits that are available to you in the areas of employment, disability, and health insurance issues. So you can find some more state-specific information on our site as well. And then we also have educational materials and quick guides on a variety of topics, including some of the ones that we're going to talk about today. So we do have a quick guide on disability insurance and one on reasonable accommodation. So those might be things that you want to take a look at for more information or as a reference to some of the things that I'm going to talk about. And because we live in an interesting time and things are constantly changing, whether it be in the health insurance arena or in employment or other areas of the law, we also share that information on our educational blog. So that's where we're sharing late breaking news, but it's also where we're sharing information on different types of substantive cancer survivorship issues. And I do feel like I should say at this point that when we talk about cancer survivorship, we mean dealing with a cancer diagnosis from the point of diagnosis throughout life and all of the things that might arise. And so we adopt the NCI's definition. And I know that that is a very personal thing for everyone. So I just wanted to say that up front. We also have a monthly newsletter where we're sharing information, events that are happening in the cancer community, our resource partners, things like that. We also have a website called cancerfinances.org that we created in partnership with another organization called the SAM Fund, which provides financial assistance to young adults with cancer. And this website is a bit of a choose your own adventure educational resource. So you can go to the site and pick a topic like disability insurance or health insurance and answer some questions, and it tailors the information to you based on how you've answered those questions. It also has an entire module just on financial assistance resources, so that might be something that could be helpful to you. Now, I do want to take a step back and look at taking time off work in a big picture sort of way, because we know that an estimated third of individuals who've been diagnosed with metastatic breast cancer actually continue working. And so even though this webinar is focused on disability insurance, I want to start with the idea of how do you make the decision to stop working and what types of resources could be helpful to you as you start that process and go into applying for disability insurance. And so how you can use these various laws and protections together to find a path forward. Now, I'm not going to spend a lot of time talking about the ADA or the FMLA, but I want you to be aware of them and know that there's information on our website for more information on those topics. So when we're talking about taking time off work in shorter segments of time, then there might be employer policies that are going to be helpful to you. You can use the ADA and the FMLA, but then you might also be looking at a short-term disability option. When you're talking about taking longer periods of time off work, then you're really looking at how the FMLA can help you with that transition and maybe even the ADA, and then accessing long-term disability benefits. So when I talk about employer policies, I mean looking at all the benefits that can be available to you. And we often really focus on what the law provides, but there are so many employers that go above and beyond what the law requires and provide you with additional benefits. So step one is really looking at your employer-specific policies and see what benefits are available to you. But then there are also state laws that can help in a variety of different ways. And I've just included some of what those could be depending on the state that you live in. But you might also want to look to those laws for protection, especially as you're transitioning out of work and into applying for disability benefits. Some of these laws can also be helpful for caregivers as well. So if you have family members who are caring for you, they could potentially access some of these benefits and protections. But generally speaking, when we talk about taking time off work, the most significant law that we talk about is the Family and Medical Leave Act, or the FMLA. And the FMLA allows people to take time off work for their own serious medical condition or as a caregiver for a spouse, a parent, or a child. And those are actually pretty limited definitions of who you can care for. So it can't be a parent-in-law or a grandparent or a sibling or an aunt or uncle. It has a limited definition of who you can care for. So it's good for people that can fall into that category, but there have been numerous efforts in Congress over the years to try to expand access to the FMLA, but nothing's been successful to date. So in order to use the FMLA's protections, you actually have to work for a large enough employer. So you have to work for a private employer with at least 50 employees, but it's 50 employees within a 75-mile radius of where you work. And the reason that's important is that sometimes people will say to me, well, there's only 10 people who work in my office, so I must not qualify for the FMLA. But if you work for a company that has multiple offices, or a bank that has multiple branches, or a restaurant that has multiple locations, you can actually add up all the employees that work at those various locations to see if the FMLA applies to you. So sort of a good rule of thumb is not to assume that you don't have access to it, but to check and make sure. You also have to have worked long enough for the employer. So you have to have worked for the employer for at least 12 months and to have worked for the employer at least 1,250 hours in the last 12 months. So the 12-month requirement is a little bit flexible because there are lots of industries where people sort of come and go from a job and work for the same employer multiple times. So if you worked for an employer for 7 months and then leave and then go back and work for another 5 months, at the end of that 5-month period of time, you'd actually be eligible for the FMLA because you can add up the past months that you worked for the employer. And you can look back into your work history 7 years to gather those 12 months. But when we're talking about the hour requirement, you have to have worked the 1,250 hours in the last 12 months that you worked for the employer. And that comes out to be a little bit more than part-time if you worked all 52 weeks a year. So what does the FMLA do for you? It gives you up to 12 weeks of leave per year, but you don't have to take all 12 weeks at the same time. So you could use it even at the lowest level of an hour of time, or you could use all 12 weeks at once. So it's flexible in that way as well. But the downside to the FMLA is that it's unpaid leave. So generally, most people can't afford to take time off for 12 weeks without having any sort of income coming in. Now, the benefit to taking time off under the FMLA is that your job's protected while you're taking that time off, where normally if you were just taking a sick day or a vacation day, your job isn't generally protected that way. So not only does it protect your job, but it also protects your health insurance benefits if you get your health insurance through your employer. And this is really the key as to why I'm talking about this in the context of a disability insurance webinar. Because if you're taking time off under the FMLA and your employer normally pays 100% of your health insurance premiums, they have to continue paying your health insurance premiums for the period of time that you're on the FMLA. If they normally pay 50% and you pay 50%, that has to continue for the period of time that you're off work under the FMLA. So if you are taking time off under disability benefits, for the first 3 months of taking that time off under disability benefits, you could potentially also qualify for FMLA leave for those first 3 months, which would protect your job, at least for those 3 months, but almost more importantly, it would protect your health insurance coverage for those first 3 months. And that means that your employer couldn't have you go on COBRA and make you pay for your health insurance premiums yourself. So that might be something that's beneficial for you. Now, the FMLA can also sometimes work with the ADA. So if you're taking a shorter period of time off, then you could take time off under the FMLA, but if you've used up all 12 weeks in that year, you could potentially ask for additional time off as a reasonable accommodation under the ADA. Now, the reason I mention all of this is because all of these laws and benefits and protections, it's important to understand your options under all of them because they all sort of fit together like a puzzle. And everybody's puzzle looks a little bit different based on where you live and what you have access to. But when you can understand how the puzzle pieces fit together, you can find your best path forward. Now, I mentioned there are some benefits available for caregivers. So if you happen to live in California, DC, New Jersey, or Rhode Island, as of today, you as a caregiver would have access to the ability to take time off work and to get some wage replacement while taking time off as a caregiver. Now, Washington actually has this benefit, but it's never been funded, so it effectively doesn't exist. And New York only recently passed this protection, but it doesn't actually start until 2018, and then it gets phased in over the next couple of years. Also, if you are caring for someone who qualifies for Medicaid, even if they're not receiving Medicaid benefits, but would qualify for Medicaid, depending on the state that you live in, you might be able to get paid as a family member to care for your family member. So you get paid as a caregiver through this Medicaid program, and it's called something a little bit different in every state, but generally something like in-home support services. Unfortunately, it varies from state to state, and sometimes because of limited state budgets, this is one of the programs that often gets cut very quickly, but it could potentially be beneficial for you. Now, when we're talking about taking time off work for yourself because of your own medical condition and your need to take time off work because of it, disability insurance is really the primary source of income to replace those lost wages if you need to take time off. And when we're talking about private disability, the challenge with having private disability coverage is that every policy and every company does things differently. So it's really hard to generalize across all types of policies. So there's some important things that you want to find out about the coverage that you have, like how does the policy actually define disability? Because every law that we talk about and all of these policies have a very specific definition of disability. And I'm going to talk about that more in just a minute. But you want to know what are the actual benefits. So how much does it pay you? So policies could replace your wages between 50% and 90% of your wages. I don't think I've ever seen a policy that covers 100% of your wages, but it may be out there. So then understanding how long your benefits are going to continue. Does it work with other types of disability coverage? So you want to actually go and find this information, whether you get your policy through an employer or you buy it directly. Because when we're talking about private disability insurance, there's two types of coverage. There's short-term disability and there's long-term disability. Short-term plans could cover you for 6 months to 12 months, depending on the plan. Long-term plans typically cover you for a year or longer. And the way that you get access to private disability insurance, as I mentioned, is something that you would get through an employer. So it's part of an employee benefits package, or it's something that you go directly to an insurance company and buy a disability insurance policy. But the challenge is that disability insurance is different than health insurance in that it doesn't have the same pre-existing condition protections available. So when you apply for disability insurance plan, they can ask you medical questions and they can deny you or charge you based on your pre-existing conditions. So it's actually very hard to get a disability policy from a private company once you already have a pre-existing condition, unless you're getting it through your employer as part of an employee benefits package. So oftentimes people will say to me, well, I don't have a private disability plan through my employer. And I send them back to look at their employee manual, and it turns out that they do have access to the plan because it was just a piece of paper that they filled out and signed on their first day of work, and then they threw it into a drawer and really never thought about it again because they didn't need it. So it's always important to go back and look to see if this is something that you have available to you if you didn't buy it from a company yourself. And then there are a few states, 5 to be exact, in Puerto Rico that offer state disability insurance, or SDI. And state disability insurance are short-term disability plans that typically last up to a year. And the requirements and benefits are slightly different in every state, but generally the standard of disability is much lower for a state disability insurance plan than other types of disability insurance. And so you have less work to do to prove that you're unable to work because of your medical condition. So if you want information about how to apply for these specific benefits, we have the contact information for the state agencies that run these benefits on our website. And then there are the 2 federal long-term disability programs that are run through the Social Security Administration, or SSA. And the 2 long-term disability programs are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, which is SSI. So we do love our acronyms. But both of these programs are administered through the Social Security Administration. And so if you want more information on these topics as I go into them, you can go to the Social Security site for that information. But there are a large number of people in the United States that are accessing these 2 disability programs. Now, both of these programs have the same very high standard of disability. So SSA defines disability not just as a medical condition, but it's a medical condition that is expected to last at least a year or longer, or to result in death, and is keeping you from doing your job. And really not just the job that you have right now, but pretty much any job that you've had at least over the last 15 years. So they're really focused not on your medical condition, but how your medical condition is impacting your ability to work. So it's very important that when you explain your medical condition and how it's impacting you, that you're focusing on work, because that's what they're looking at in determining whether or not you qualify for benefits. Now, even though this is a federal program, it is administered at the state level through state disability determination services. So what's challenging about that is that sometimes when you call them in one state and you call them in another state, you can get slightly different answers to the information that you're trying to get, because it's being administered in 2 different places. So it's important to actually make sure that you're getting access to correct information and not sort of relying on something that somebody else told you, because it could depend on where you live. Now, one of the questions that I get asked most often is, can I apply for Social Security disability benefits if I'm still working? Because I know that next month I'm going to stop working, and it would be great to start the application process now. And the answer to that question is, it really does depend, because this is the step-by-step sequential determination process to see if someone qualifies for disability benefits. And that first question asks, are you working? If your answer is yes, you get kicked out immediately, because if you are still working, then as far as they're concerned, you don't qualify for benefits. But that's not the whole question. The whole question says, are you working and earning more than $1,170 a month? Every year, Social Security determines a threshold amount that if you make under that amount, as far as they're concerned, you're not actually working. And this threshold amount is called the Substantial Gainful Activity amount, or SGA. And this year, the SGA is $1,170. So if you're working and making under $1,170 a month, you can still get past this question. So it allows you to actually keep going through the process, because as far as they're concerned, you're not actually working. So that's why the question is, it depends, because it's going to depend on how much money you're actually making in your work. Now, the rest of the questions, the next 2 are focused on your medical condition, and generally speaking, someone with metastatic breast cancer isn't going to have a challenge getting through the next 2 questions, but if someone has metastatic breast cancer and is still able to work, then they would have a challenge with the last 2 questions. Because again, it's not just about the medical condition, but how the medical condition is impacting your ability to work. So when you apply for Social Security disability benefits, they look at everything. They want all of your medical records, any additional information that you can provide to explain how your medical condition is impacting your ability to work. And so in gathering this information, you should really work with your healthcare team to help support you in this process. But it's also really important that you take a look at your medical records before you submit them, because sometimes healthcare professionals make all sorts of notes in our medical records. And occasionally we've had circumstances where a physician has written into somebody's medical record, patient is responding well or doing great. And what they're referring to is maybe how a tumor is responding to a chemotherapy agent. But it doesn't mean that the patient is doing great overall. But when Social Security sees that, it's very confusing as a standalone piece of information. And so they think, well, if the patient is doing great, then they should be able to work. And so if you find notes like that in your medical records, talking to your healthcare team about providing additional information to explain what they meant could be very helpful and could facilitate getting your application through the process that much easier. Now, there are a couple of programs that can speed up the initial application process for Social Security disability benefits. And part of the challenge is that sometimes that application process can take a very long time, months. And so if there's ways to speed it up when you really need access to benefits, that could be helpful. And one of those programs is called Compassionate Allowances. And this was only a program that was started in 2008. And effectively, it's a list of medical conditions where if someone has a medical condition on this list, they're presumptively eligible for disability benefits. If that doesn't mean that someone automatically qualifies, it just means that it speeds up that initial part of the application process because the medical condition suggests that someone would be eligible. But they're still going to look at, does the medical condition keep someone from working? And that's the key. Now, with the Compassionate Allowances program, I've included the link on the slide of the full list of medical conditions. Metastatic breast cancer is on the list. But even when someone's application process has been sped up under this program, there is still a 5-month waiting period for Social Security disability benefits. And I'll explain that more in just a second. But this is the framework for, or the definition from the Social Security website for someone with metastatic breast cancer. So you would actually qualify as having a medical condition on the Compassionate Allowances list if you have stage 4 breast cancer or metastatic breast cancer, and they've included all of the medical definitions of metastatic breast cancer. And so this is a good program to help speed up that application process if you have a medical condition on the list. Now, I'm not going to go into these two other options, but the information is here on the slides, and you will be sent the slides after the presentation. But these are two other resources that may be helpful to you that existed prior to the Compassionate Allowances program, but they're there if for some reason Compassionate Allowances isn't available to you. Now, even though SSI and SSDI have the very same high standard of disability, there are differences between the two programs. SSDI is based on your work history. So it's based on what you have paid into the Social Security retirement system throughout your life, and what you've earned over that work history. So the amount that you get each month from SSDI is going to be different based on what you've earned over your work history. But this year, the amount of your monthly payment is actually capped at $2,687. So if you make $1 million a year, you're going to get more than if you made $100 a year over your work history. But again, it's still going to be capped at that amount. Now, the downside to Social Security disability insurance is that it has a 5-month waiting period before your cash benefits begin. So you actually have to go 5 full months without receiving benefits before you get your first check. Now, most people can't go 12 weeks under the FMLA. Most people can't go 5 months under SSDI without having any sort of income coming in. So this is a true barrier to this program, but it is something that could be helpful to you. Now, even though you have a 5-month waiting period, Let's say, for example, that you've been out of work for the last year because of your medical condition, but you're only learning about this program today. So you apply today for SSDI and they qualify you. You could potentially get paid back retroactive benefits up to 12 months from the date that your disability began. But they're still going to take out that 5-month waiting period of time. So if your disability began a year ago and that's when you stopped working, then you would get 7 months of benefits, approximately. But it's important to know that it goes back to the date that your disability began. And that's a distinction when we're talking about a cancer diagnosis that's important. Because even though you might have been diagnosed on day 1, you might not start treatment or might not be able to work anymore at a date past that. So they're not looking at the date that you were diagnosed. They're looking at the date that your disability began. And for Social Security, again, that means when you're no longer able to work. So the timing is going to be different for everyone. And the amount of retroactive benefits that someone could qualify for is going to depend on the day that they apply, when they qualify for the benefits, and when the date that their disability actually began. So that's why everybody's retroactive payments could be different. Now, SSDI is actually tied to Medicare, one of the 2 federal health insurance programs. So after you've been receiving SSDI payments for 2 years, then you become eligible for Medicare. So there's a 2-year waiting period before you get access to health insurance coverage through SSDI. Now, SSI isn't based on work history. It's only based on your low income and low asset level. And when I say low asset level, that means that you only have $2,000 in savings as an individual or $3,000 as a couple. So that's a pretty low asset level. And it's not just looking at your savings account, it's looking at things like, do you have a 401k plan or retirement plan that's worth more than that? Do you have a cash value life insurance policy that's worth more than that? Because those are considered assets under Social Security or supplemental security income. SSI payments are the same for everyone who is qualifying for SSI because of a cancer diagnosis. So the maximum payment is $735 a month. But most states, except for Arizona, Mississippi, North Dakota, and West Virginia, actually add additional money to those payments. But the amount that every state adds is different. So you might live in a state where your SSI payment is $835 a month because the state is adding an additional $100 to your federal payment. Now, SSI pays back retroactively as well, but only back to the date of application, not to the date that your disability began. So that's another difference. SSI is tied to Medicaid, the other federal health insurance program. And in most states, you automatically qualify for Medicaid if you qualify for SSI because the income and the asset levels are the same, except for these 9 states that I've included on the slide. So if you don't have the slides in front of you, that's Connecticut, Hawaii, Illinois, Minnesota, Missouri, North Dakota, New Hampshire, Oklahoma, and Virginia. Now, I've included also some additional information on what counts as income under SSI and what counts as resources, but I'm not gonna read you the slides. The information is there for you. But it's important to note that many people will actually try to transfer their assets to family members or friends so that they can meet the income and asset requirements for SSI. But there's actually a 3-year look-back period. So they will look at your assets and income going back 3 years to see if you are trying to game the system. So I definitely recommend that this is something that you keep in mind in applying for these benefits. Now, in addition to the application process for SSI and SSDI being challenging, this system is effectively set up to deny people the first time around. So about 60 to 65% of claims every year get denied initially. And we tend to be a society where we take no for an answer. And this is one of those circumstances where you don't want to do that. Even though the appeals process can be challenging and take a while, it's worth doing because at each level of the appeals process, you're much more likely to get approved and get access to the benefits that you need. And because they pay retroactively, it's worth doing it even if it does take some time. Now, the first level of appeal, if your application is denied, is called the request for reconsideration. There are some states that I've listed on this slide that actually just skip this level and go straight to a hearing with an administrative law judge, also referred to as an ALJ hearing. And this is where most of the claims end. You could still appeal a decision by an administrative law judge, but it's pretty uncommon generally. And most of the time, the appeals council or the federal courts are going to defer to the judgment of an administrative law judge. Now, these ALJ hearings are really different than anything you've ever seen on television about a courtroom hearing. It's generally much smaller. There isn't a jury. The judge is the one who gets to ask the questions. And you and your representative are there, but there's also usually a vocational expert and maybe another medical expert. And again, the judge is the one who asks the questions, and the judge is the one who makes the decision. And it's a very subjective process in that the judge gets to decide. But most administrative law judges have an incredible amount of knowledge around medicine. And so they have a good understanding of the benefits that people are applying for and the medical conditions that they might have and how those relate to someone's ability or inability to continue working. Now, there's a resource called disabilityjudges.com, and you can look up your state. So I've given you just a snapshot of what Colorado looks like as an example, and it tells you up-to-date information about your state, like how long it's actually taking to get a hearing in that state, and how long it takes for a claim to actually be fully processed, and your chances of actually winning your hearing. So you can see there's 2 jurisdictions in Colorado, and there's not a lot of difference. But for example, if you live in Charleston, West Virginia, your chances of being denied are around 12%. Whereas if you live in Dayton, Ohio, your chances could be much higher at over 50% of being a chance of being denied. So where you live and what administrative law judge hearing location you're going to could affect your chances of actually getting approved, because this is a process that can be subjective. And on the slide, I've also included a link at the bottom that links to Social Security's website, where they have data on all of the individual judges. So actually, if you're going to a hearing and you've been assigned a judge, you can actually look up your judge. Now, you can't change your judge based on that information, but at least you can look to see what your chances are. Now, I often get asked, do I need to hire an attorney in either the application or the appeals part of applying for disability benefits? And it's a very personal decision about whether or not you think that would be helpful to you. If it were me, I would hire an attorney if I were going to an administrative law judge. And I wouldn't hire a tax attorney. I would hire a Social Security disability appeals attorney specifically, because that is an environment where the judges work in those courtrooms every single day, or the attorneys work in those courtrooms every single day, and they know the judges and they know the experts, and it's generally a pretty collegial environment. And so having someone who knows that environment and knows how to present the information effectively could be very useful, but it is certainly not required. So we've included some additional resources on how to find an attorney near you who could represent you. But it's also important to know that this seems to be an area of the law where we see a lot of scams. So if you have an attorney saying they're going to charge you 50% of your benefits, that sounds like a scam, because the law actually limits how much an attorney can charge you to represent you in an appeals hearing. And so we've included that information for you as well. Now, in the same way that some of these laws and benefits can work together and provide you with additional benefits, they can sometimes pose some challenges if you don't know how to navigate them. And one area where we see people get tripped up a lot is where they have a private long-term disability plan, either one they've gotten through their employer or one they've bought themselves. And then at some point, you start receiving those benefits, and maybe a few months into receiving those benefits, you get a letter from your long-term disability company that says, we'd like you to apply for SSDI. And they are actually allowed to require you to do that as a condition of continuing to receive their benefits. And sometimes they actually even help you with the process of applying, and they assign an attorney to you to help you with the process. So that could be additionally helpful to you. But it's important to remember that that attorney actually works for the long-term disability company as opposed to you. Generally, it doesn't pose a conflict, but it's something for you to keep in mind. But once you apply for Social Security disability insurance benefits, it could potentially lower what you get from your long-term disability company because they prorate the amounts. So it's important to look to see what your policy says about how much you would continue to make. But where we see people have challenges is that they go through the application process for SSDI, and then they get approved, and they get paid back retroactive benefits, which is great, except you get that first check and you get super excited because it's a larger check because it usually covers multiple months of your payments. And most people get excited because they think that they can finally pay their bills. And it turns out that they spend that money, and then a few weeks later, they get a letter from their long-term disability company saying, please send us our money, because you've now been paid twice for the same period of time that you've been off work. And that retroactive money from Social Security disability insurance is actually owed back to the long-term disability company. So once that's happened and you've spent the money, if you're unable to pay the long-term disability company, they are able to put liens on your disability benefits and lower what you actually get paid each month to pay them back. So it's very important that you understand how these two work together for your policy specifically before you spend that retroactive benefit check. Now, I mentioned earlier that there's a benefit sometimes, even if you know that you're going to go out on disability benefits for a longer period of time, to take that initial period of time off under the FMLA because it could protect your job and your health insurance benefits. And so we actually have a quick guide that explains how all of this works together in greater detail if it's something that applies to you. And so this is just another example of how this could potentially work. So, for example, Jane's doctor suggested that she consider going out on disability, but she also has 3 weeks of vacation, 3 weeks of sick time. Her employer is covered by the FMLA, and her employer offers a short-term disability insurance policy that lasts up to 12 months. What are Jane's options? So when you look at the right-hand side, she could take the initial 3 weeks off of work as sick time, then take the next 3 weeks off of work as vacation time, and then start drawing on her Social Security or her short-term disability policy, which would pay her for the additional period of time that she needs to be out of work, up to 12 months. On the left-hand side, the FMLA leave is focused not on the money and how to replace wages, but on the job protection and the health insurance protection. So that at least for the first 12 weeks of someone being out of work, in this case Jane, she would have access to that job protection for 12 weeks, as well as the health insurance protection. Now, some employers are going to have a policy that say, well, keep your health insurance benefits going for the full time that you're out on short-term disability. And other employers might say, we're going to have you go on COBRA once your FMLA time has expired. And that's why looking at the employer-specific policies is going to give you more information about how you can work all of these benefits and protections together to have the greatest period of time with job protection, health insurance protection, and then actually replacing wages so that you have income coming in. So at the end of the slide deck, I've included some additional resources on disability insurance, including a direct link to Social Security's publication on disability benefits to talk about, get more information about these issues, but there are a plethora of other resources on the Social Security's website on how all of these benefits can work for you. And then we've also included our contact information. And again, if you have personal questions that you don't want to pose on the webinar, you are always welcome to email us or to take a look at our website to see if there's additional information that could help you out. So at this point, I think I'm going to turn it back over to Christine for some questions.
Thank you, Joanna. So question number one, someone is writing in that they believe that when they were approved for SSDI, that they were told that they would be reviewed in 3 years. Should they be concerned?
No, and that's actually a pretty standard process. So for most people, Social Security actually has the right to review whether or not you still qualify for benefits each year. And it's a pretty standard process. You just have to provide medical documentation that you still have the medical condition that is keeping you from being able to work. And so with a medical condition like metastatic breast cancer, that is less complicated than if you have other types of medical conditions. But again, it's important to work with your healthcare team to gather the information to be able to provide in that review process.
So another question, how is SSDI benefits taxed?
So SSDI benefits are taxed, but it's based on your household income and a couple of other different factors. There is a guidebook on Social Security's website on SSDI taxes. SSI taxes, supplemental security income, SSI benefits are actually not taxed. So it's a little bit based on your income level at the rate of tax that you would have to pay. And there's a formula for that and a chart on Social Security's website.
Great, another question. If I start working part-time while on disability, when do I have to start reporting the income?
If you think that you want to start working, it is generally very important that you let Social Security know. Because if they find that you are working, then you could potentially lose access to your benefits, and you don't want to do that because there are entire processes set up to help someone return to work if they want to. And this program is called Work Incentives. And you can actually go onto ssa.gov and search for the term work incentives, and it will explain all of the different programs, both for someone who has benefits under SSI and for someone who has benefits under SSDI. And some of these work incentives are things like a trial return to work period, where they give you 5 years, a 5-year period of time where you can try to go back to work if you want to or are able to, and not lose access to your cash benefits or to any health insurance coverage that you might have attached to your cash benefits. So it's a great way to test to see if you're able to work and to bring in some income, as long as you're doing it within the process that they've laid out. And that's why it's important to notify them that you are going to try to return to work. Because even though it starts that clock running on your 60 months, doing it within the process protects your access to the cash benefits and to the health insurance coverage. So in addition to the trial return to work period, they have things like job training and vocational rehabilitation and ticket to work programs where they can help you try to identify work. So there's lots of other benefits to encourage people to go back to work if they are able to. And so that information is on the Social Security website.
Right, so someone is asking, what do people on SSDI do for medical insurance while waiting 2 years for Medicare?
So it really depends on what you might have access to. So if you apply for disability benefits and you leave your job and you had health insurance coverage through your job, you could go on COBRA for a period of time, which is beneficial because it's generally the same same health insurance coverage that you had when you're employed. So it allows you to maintain that coverage, and you don't have to worry about finding new coverage or if your providers actually take that new coverage. But the downside to COBRA is that it can be very expensive. So you are paying not only your portion of the health insurance premium, but then potentially what the employer was paying for your health insurance premium plus a 2% administrative fee. So it can be cost prohibitive for people. But you could also now look at a marketplace plan. Now, depending on where you live, your choices in the marketplace could be substantial or more limited. But it's always a good idea, in my opinion, to go look to see what's available in the marketplace and compare it to COBRA or your other options, because you never know. You might find that the marketplace plan is less expensive and has better coverage, or you might find that the employer plan does. So it's a good idea to actually do some comparison shopping. The third option for someone generally is to then look to see, is there another employer plan that they can move to in their family? So if they're married, could they move to a spouse's plan? If you're a young adult and you're aging out of your parents' coverage, could you move to the COBRA plan or the marketplace option? So there's more options now for someone in that position to fill that gap before Medicare begins than there existed previously. But I will say that that is generally up in the air as well in terms of access. So I mentioned that there's a lot going on related to health insurance coverage. And even though the Senate has pushed off a vote for their current proposal, it will likely happen in the next month or so. And so continuing to pay attention to those changes is something that we plan on doing, and certainly the rest of the cancer community as well. And so if someone's interested in finding more information about their health insurance options, I would point them to the cancerfinances.org website, because there is a module on health insurance. And so if you answer some questions, it will share information related to your health insurance options.
Great. Another question. Will my Social Security benefits be lowered if I get a pension from work?
That's a little bit different, because if you are, it could depend on your pension. So if your pension is set up in a way that you have to take full retirement, then taking full retirement, but then also saying that you are working and then unable to work because of your disability benefits, those could potentially be in conflict. So it depends a little bit in the way that your quote-unquote pension or retirement plan is set up. So you want to go back and look to make sure that there's no conflict. But generally speaking, if someone is receiving a pension or retirement benefits, it's not going to impact their, let me rephrase. If someone's receiving a pension or retirement benefits from an employer, not through Social Security, then and is still able to work and is working, and then because of their medical condition have to stop working, they could still potentially access Social Security disability benefits, mostly SSDI, because generally someone's pension and benefits might kick them out of the income eligibility for SSI. If you are receiving Social Security retirement benefits, you cannot then go and apply for Social Security disability benefits, because effectively you are getting access to your retirement benefits early because you have a disability that's making you unable to work. So saying that you get access to both at the same time is actually sort of contradictory.
And what about unemployment benefits?
So it's the same thing about claiming something that's contradictory. So sometimes, especially if you are in a state that has access to state disability insurance, if you are accessing state disability insurance because you're unable to work, you can't also claim that you qualify for unemployment benefits, because generally the requirement to access unemployment benefits you are saying that you are able and ready to work if a job were to come up. So unemployment means you're able to work, and disability benefits mean you are unable to work. So you can't really claim both of those things at the same time.
Got it. So someone is asking if people who have a stage 4 diagnosis but are currently have no evidence of disease, would they have any issues applying? Or should they wait until the next progression?
So it's a little hard to answer that generally, but I would say if generally someone, even with a diagnosis of metastatic breast cancer, has no evidence of disease and is not being impacted in any way by their medical condition, and therefore would be able to work, isn't going to qualify for Social Security disability benefits. You may be able to qualify for state disability insurance or an employer or private disability plan, depending on how they define disability. But for Social Security disability, it's really focused not just on your diagnosis, but on your ability to work. So if you have no evidence of disease and are not being impacted, then you probably wouldn't qualify for disability benefits.
So some people are writing in and they thought stage 4 was an automatic approval. So
that's exactly why I made that distinction, because compassionate allowances is not automatic approval. It's presumptive eligibility. So it's only saying that we're going to speed up that initial part of the application process because we presume that anyone with these types of medical conditions, such as metastatic breast cancer, would be eligible. But they're still going to go through the full analysis to see if that medical condition is keeping that individual from being able to work, and not just the job that they have right now, but any job that they've really had over their work history. So compassionate allowances is not automatic qualification. It really depends on how an individual's medical condition is impacting them individually and their ability to work. And that's a much more nuanced assessment than just saying everyone with this medical condition automatically qualifies for disability benefits.
So my watch is still saying 129. I have one last question. If you're on SSDI, are your children eligible for benefits?
They may be. And it's going to depend on your work history and some other factors. But generally, they may also, and their age, so they may also be eligible for benefits.
Well, thank you so much. Go ahead.
I was just going to say that information is available on Social Security's website, and also if you call Social Security. And I would just mention one other thing. Every year, we're supposed to get a written statement from Social Security that has a history of what we've paid into the system and tells us if we were to retire at age 65, for example, this is what we would get paid every month in retirement benefits. It also says if you were to become disabled this year, this is how much you would get paid monthly. So you can actually look up your Social Security statement and find out exactly how much you would get paid and what their records are related to how much you've paid into the system. So it's also a good idea to make sure that's accurate, because your monthly SSDI payment is going to be based on their records of what you've paid into the system. So if you don't get this statement mailed to you, you can actually go to Social Security's website and create an online account and get access to your statement.
Great. Well, thank you so much, Joanna. This has been really incredibly informative. Thank you all for participating. Thanks, Joanna. We appreciate it.
Thank you. Have a good day.
Thanks. You too.